Hi, Kevin Henry of Dental Economics, here today on the Royal Caribbean Liberty of the Seas. We're on the Miles Global Team Appreciation Cruise, and we're with Dr. Rhonda Savage. First of all, thank you for partnering with Penwell on this.
Thank you, Kevin. You know, Penwell's a wonderful partner, and mostly I think that I really appreciate how much Penwell does as far as delivering quality education, quality pieces to, the readership. So I think that's huge.
Thanks, we appreciate that. Well, we're through day one of the Miles Global teaching, and Rhonda did a great job. And some of the things that stood out to me during the talk were the sick patient and what you need to do whenever the sick patient calls and tries to get out of his or her appointment. So Rhonda, if I'm a patient and I call and I say, you know what, I've got a cold, I just don't feel like coming in for my 10 o'clock appointment. Tell me what you would instruct an office to say in response to that.
Well, I think that with all policy, anything we have, we need some flexibility, but patients need to be responsible for their time, and many times they just don't want to come in. Sickness can be a problem, but they just typically don't want to come in. So what I recommend the team do is to let the patient know that we do wear gloves and masks. We can treat them as long as they're comfortable coming in, we can take care of them, and the appointment is very important.
Okay, so I've got a cold, thank you for wearing gloves and masks, but I just don't feel like coming in.
Kevin, this appointment that we did set for you is really important. You've got a crack through your tooth, you've got a deep cavity through the tooth, and I've seen these teeth break. So I do understand how you feel, but if you can come in, it's very important. Has that tooth been biting sensitive yet? Has it woken you up at night yet? Unfortunately, we see these things happen. We see teeth break, and we can save you thousands of dollars of dentistry down the road if we can prevent those things from happening to you right now that you don't need, and that's important. So if you do feel you can make it in, this appointment is very, very important.
And I liked one of the things that you said, if I keep saying no, then finally, you're going to let me off the hook, as it were.
Yes.
Then what would you instruct a doctor or a team to do in response to that?
Well, if the patient claims to be sick, then a really neat technique is to take a stack of get well cards and you pass them around at your team meeting, and everybody sign their name anywhere they want. So they're signing their name, and the cards continue going around, so everybody puts their first name on the card. And then as they continue going around, we start stuffing them in the envelopes and sealing the envelopes and putting stamps on them. So then the front desk ends up with a big stack of get well cards, and if the patient does claim to be sick, we mail them the card that day. But see, it's all set and ready to go, so it's very simple to do. They just address it and pop it in the mail. And it does two things. If your patient is truly sick, they will appreciate the card. If they're not sick, they'll feel guilty, and most likely won't do the same or have that same excuse again. But patients' last-minute cancellations and broken appointments are a problem for most practices in today's world. So it's about dissuading them from canceling, letting them know it's important that they come. And another verbal skill I could share with you is when the patient says, gosh, my appointment changed, everything changed today, I just can't come in. Say to the patient, I do understand how you feel, but I am concerned for you. You do have definite need for this tooth to be treated, and we can save you thousands of dollars worth of work down the road. Real important that you get this taken care of now. How can I help you keep your appointment? And then go silent. It's a professional silence, and this is the key. The team member at the front desk should not break that silence. The patient has to speak first, and that's really key.
And real quickly, touch on the subject of how you feel about broken appointments should be handled from a charging standpoint. Should the patient be charged for that?
My feelings are that broken appointments, if you charge for it, there's no way you can make up the time. You're not going to ever recover that lost time. It doesn't matter what you charge for the broken appointment, whether it be $50 or $75 or $150, you've still lost that time and that opportunity. So Kevin, I would rather that the office have a firm broken appointment policy. Again, all appointment policies, all policies in the practice need some flexibility. But if the patient is flagrantly disrespecting your time, I recommend that you dismiss the patient rather than keeping that patient within your practice. And I'm not fond of charging patients for a broken appointment because the patients perceive it as they're getting charged for something they didn't get, and they're not happy. So then what happens is we send the bill, they don't pay it, we send another bill, they don't pay it, we send a third bill, and then we go to the doctor, the office manager, and say, hey, what should we do with this? And they say, just write it off. well, you've angered the patient more. And so I'd rather you have a policy. In my office, it was a 3 strikes, you're out. And now, it was 3 strikes within a certain period of time. And obviously, it didn't hold, one of the broken appointments if the patient had had a serious illness or something in their family. But I'm talking about patients who are repetitively not making the appointment. We need to change that. Now, one exception, I should say, to a broken appointment policy is I do like on our phone messages, if the patient can leave a message, that the last thing we say on the message on the recorder is, please be advised if you are calling to change an appointment for tomorrow, a last-minute change fee may apply, or a last-minute cancellation fee may apply, or a last-minute cancellation fee of $100 will apply. Now, we didn't charge it. We just had that there because patients will hear the last thing they hear, and I don't want them to cancel on your recorder. I want them to call the office the next day, and it's our front desk responsibility to keep that patient on the schedule.
All right, Ron, thanks so much for your time. I
Thank
appreciate
you,
it.
Kevin. Appreciate it.